Hey everybody, this is chapter 15, and here we're going to be talking about the autonomic nervous system. So autonomic literally means self-governed, and the autonomic nervous system, or ANS, is a system that functions independent of our voluntary wanting or needing it to function. It just works on its own. It regulates a lot of things that keep your body in homeostasis, including your heart rate, your blood pressure, and your body temperature. It also is involved in the fight or flight. Sometimes we think of it as the fight, flight, or freeze mechanism. And that phrase and homeostasis were both founded by Walter Cannon, who spent his career studying the ANS. So starting here with section 15.1, we're going to be looking at some of the general characteristics of the ANS. Specifically, we're going to look at explaining how the autonomic nervous system is different from the somatic nervous system in both their anatomy and their physiology. Then we'll talk about the two broad divisions of the ANS and how they are different in their functions. The autonomic nervous system is a motor nervous system, and it is responsible for controlling and regulating various glands in your body and your cardiac muscle and your smooth muscle. Remember that smooth muscle is typically found surrounding your veins and arteries and surrounding your digestive tract. Another name for the ANS is the visceral motor system. Talk about the ANS, we talk about its primary organs, being the viscera, found both in the thoracic and abdominal cavities, and then also some structures in the body wall, including cutaneous blood vessels, sweat glands, and piloerector muscles. The ANS, we already mentioned this, acts involuntarily. We don't determine consciously when we're going to get goosebumps or when our heart is going to beat. So our ANS works outside of our conscious control. When we talk about visceral reflexes, we're talking about the automatic responses that we have. They happened in a stereotyped manner, meaning they tend to happen the same way every time. These visceral reflexes involve visceral receptors and effectors. So the visceral reflex arch happens when receptors, which are the nerve endings, and nerve endings here are detecting stretch of muscles and tendons, tissue damage, a lot of different chemical compounds in the body's temperature, and other stimuli as well. Okay, so the receptor is going to detect something going on. And then the afferent neurons are going to carry the message to the central nervous system. Interneurons in the central nervous system are going to integrate the information. And the afferent neurons are going to carry information away from the central nervous system towards wherever the stimuli came from. Then whatever response is appropriate will be carried out by the effectors. So here's an example of this. When we start with receptor here, we have the baroreceptors. If they notice an increase in blood pressure, say in the internal carotid artery, they're going to send that information along the glossopharyngeal nerve and ultimately to the medulla oblongata, where the integrating center is. And then the vagus nerve is going to return information, in this case to the cardiac pacemaker. And the effector, the final result, is the heart rate will decrease, and that will cause a decrease in blood pressure balance out the increase that was initially detected. There are two divisions of the ANS that innervate the same target organ. Sometimes the two divisions have cooperative impact, and sometimes the impacts are contrasting. Okay, so the first division, the sympathetic division, this is the thing that helps the body prepare for physical activity. Okay, and encompassed in physical activity here is exercise, also handling trauma, being aroused, having some sort of competitive interaction going on, or being angry or afraid. In all of these cases, we tend to see elevated heart rate, elevated blood pressure, increased airflow. We'll breathe more deeply and faster. We'll also have higher blood glucose levels as glycogen in our muscles is released in preparation to take some sort of action. We'll also have reduced blood flow to the skin and digestive tract, so digestion will be temporarily slowed. Your body in this needing to be prepared for some sort of physical activity considers your skin and digestion to be secondary survival at this point. So essentially here we're getting ready for a fight or flight type situation. On the other hand, the parasympathetic division, this is the calming types of functions. Okay, so this is going to be when we have increased digestion. And sometimes we think of this as a resting and digesting state. Like after you eat a big meal and you're kind of relaxed and just relaxing for a little bit. When we say autonomic tone, we're talking about just the normal, everyday things that are going on in the body physiologically to maintain homeostasis and to maintain normal health, meeting the body's normal needs. And we can divide this into two separate divisions as well. Okay, so the parasympathetic tone, this is how we maintain muscle tone in the intestine. And it's includes the resting heart rate, keeping it between 70 and 80 beats per minute for an average person. It's a little less for athletes. The sympathetic tone, on the other hand, is about keeping the blood vessels partially constricted, and that maintains proper blood pressure levels. We can also think of the ANS as having two components. We can talk about the central component and the peripheral component. The central component, the control center is the nuclei and the hypothalamus, and then other regions of the brainstem. The motor neurons in the spinal cord and the peripheral ganglia. Then we have nerve fibers that are found running through the cranial and spinal nerves. So here we're going to talk about the ANS as compared to the somatic motor pathway. So if you recall, in the somatic motor pathway, we find the motor neurons from the brainstem and from the spinal cord. They have projecting from them myelinated axons. And those myelinated axons go all the way to the skeletal muscle that they are innervating and causing to move. The autonomic pathway is a bit different. Okay, here the signal has to go across two neurons to get to the target organ. So the signal has to cross a synapse. And at that synapse, the two neurons meet in what we call an autonomic ganglion. Presympathetic or presynaptic neuron is the first one, and its stoma, its body, is in the brainstem or in the spinal cord. Then the postganglionic neuron, that one has the axon that goes all the way to the target cell. This is the beginning of section 15.2, and in this section we're going to be talking about the anatomy of the autonomic nervous system. So in the section 15.2, we're going to be looking at the different components and pathways of both sympathetic and parasympathetic divisions of the ANS. We're also going to talk about the adrenal glands and how they relate to the sympathetic nervous system. And then we're going to talk about the enteric nervous system, the digestive tract, and why it is so important to our health. The sympathetic division of the autonomic nervous system is also called the thoracolumbar division. And we have that name, the thoracolumbar division, because it arises from the thorax and lumbar portions of the spinal cord. So this picture here, we've got kind of a person's upper thorax around their chest. So we're looking at the diaphragm here at the very bottom. And we've got some of the different nerves that we've talked about previously. And the thoracic ganglion is going to be right around here. And then you can see some structures that I'm sure you're familiar with, the heart and the ribs as well. So here we have some kind of short pre-ganglionic and then long post-ganglionic fibers. Okay, remember we talked about just on the previous slide or two, the fibers here all have two neurons, the preganglionic and the postganglionic. Here, the pre are shorter and the post are longer. The fibers are going to come away from the spinal cord somewhere between your first thoracic vertebra and your second lumbar vertebra. So several vertebrae are involved here. The paravertebral ganglion are connected to the spinal nerve by two branches, and these two branches are called the communicating rami. Okay, so the two branches, we have the preganglionic fiber. These are small and myelinated, and they go away from the spinal cord to the ganglion using the white communication ramus, which is myelated. On the other hand, the postganglionic fibers are using the gray communicating ramus, which are unmyelated. Once we're in the sympathetic chain, the postganglionic fibers can go one of three directions. Some of the postganglionic fibers end in ganglia, and then they enter and synapse with a postganglionic neuron. Second choice for a postganglionic fiber is to travel up or down the chain and synapse in ganglia that are at other levels. And the third option is for the postganglionic fiber to pass through the chain without synapsing and continue as a splinter nerve. When nerve fibers leave that sympathetic chain, they can do so in one of three ways. We can take the spinal route, we can take the sympathetic route, or we can take the splinchic route. Okay, so if we take the spinal nerve route, we have some of these postganglionic fibers that exit the ganglion through the gray ramus. Then they return to the spinal nerve and travel the rest of the way to the target organ. And this is how most of your sweat glands, the pileoerector muscles that are involved in shivering, and the blood vessels that are close to your skin, and also the blood vessels in skeletal muscles, are innervated. Second possible route is the sympathetic nerve route. Okay, so in some cases, nerves leave using the sympathetic nerves that extend to the heart, the lungs, the esophagus, or the blood vessels that are found in the thoracic cavity. These nerves form something called the carotid plexus around each carotid artery in the neck, and they issue fibers from there to the effectors in the head. Okay, so things that are going to be impacted by the sympathetic nerve route are the sweat, the salivary, and the nasal glands, the pileoerector muscles that are in the head and the neck, the blood vessels, and also this is how your iris's dilating is controlled. Finally, we have the splanchnic nerve route. So the spinal nerves that rise from your 5th thoracic vertebra to your 12th thoracic vertebrae, they go through, or they can go through, the sympathetic ganglia without doing any synapsing, and they continue on as splanchnic nerves. And this leads to a second set of ganglia that we call the collateral or prevertebral ganglia. And there they synapse. Talking a little bit more about these collateral ganglia, they contribute to something called the aortic plexus, which abdominal aortic plexus, which is a complex that wraps around the abdominal aorta, and it has 3 major collateral ganglia in this plexus. So they're called the celiac, superior mesenteric, and the inferior mesenteric. Then, I'm sure you guys have heard of solar plexus at some point. This is the collective name for the celiac and the superior mesenteric ganglia. We know that neurons diverge predominantly in the sympathetic division. Each one of the preganglionic cells branches and meets up with 10 to 20 postganglionic cells after crossing the synapses. Here we're moving on to talk about the adrenal glands. So sometimes we call the adrenal glands the suprarenal glands, and they're located on the top edges of the kidneys. They have 2 different functions. The outside layer and the inside layer, they work differently. So the outside layer is called the adrenal cortex, and its job is to secrete steroid hormones. The inner portion, the adrenal medulla, has a totally different function. Okay? Its job is to secrete hormones into the bloodstream. Most of those hormones are either epinephrine or norepinephrine. Epinephrine is the formal name of adrenaline. Then norepinephrine is less well known. Its more common name would be noradrenaline, but we don't really talk about that one much in day-to-day conversation. So this inner core, the adrenal medulla, is really just a sympathetic ganglion with lots of modified postganglionic neurons. And like I said, it secretes these. When we talk about the epinephrine and norepinephrine together, we call those combined catecholamines. So now we're going to be talking about the parasympathetic division. Okay, so the parasympathetic division is also called the craniosacral division. Okay, so this comes from the brain and sacral regions of the spinal cord, and it has fibers that travel in certain cranial and sacral nerves. When we talk about this parasympathetic division overall, we're talking about some pretty selective targeting here. We're looking at very specific organs that are being targeted. We don't have a lot of neural divergence here. So we talked about some of these cranial nerves before, the oculomotor, and its job is to narrow the pupil and focus the lens of the eye. The facial nerve is involved in forming tears, and also the nasal and salivary glands. Glossopharyngeal nerve is heavily involved in the parotid salivary gland. And then the vagus nerve is very involved in many, many different body functions. Okay. So it has jobs as far away as the colon. It's involved in cardiac function, pulmonary function, the esophageal plexus, and it branches into the anterior and posterior vagal trunks. Moving on to the enteric nervous system. The enteric nervous system is the nervous system involved with the digestive tract. This does not come from the brainstem or the spinal cord. It does not have any central nervous system components, and its job is to innervate smooth muscles and glands related to the digestive system. It's made of about 100 million neurons that make their way into the walls of the digestive tract. It has its own reflex arches that are separate and different from ones that we've studied previously. And this enteric nervous system is responsible for moving things through the esophagus and the stomach, and the intestine, and also for adding digestive enzymes and hydrochloric acid that you find in the stomach. The disease that's related to a defect here is called megacolon or Hirschsprung disease. This is a hereditary thing caused by genetic inheritance, and it happens when the enteric nervous system is pretty much absent. So we have no nerves sending signals to the sigmoid colon or the rectum. And eventually the colon will constrict and feces won't be able to get through. And this causes the bowel to become very dilated and distended. It can lead to a perforated bowel, gangrene, and other infections. It's usually noticed very soon after birth when the newborn isn't able to have a bowel movement. Moving on now to the autonomic effects on target audience, target organ. So here we're going to be talking about some of the neurotransmitters that are involved at different synapses of the ANS. We'll be talking about the receptors for those neurotransmitters and how they regulate autonomic function. We'll also look at how the autonomic nervous system controls target organs through a process called dual innervation. And then we'll talk about how control is exerted when we don't have this dual innervation. So our big question here is, How do autonomic neurons have contrasting effects on organs? We've got two big reasons why. First, the sympathetic and parasympathetic fibers secrete different neurotransmitters, particularly norepinephrine and acetylcholine. The second reason is the receptors on the target cells can be different. So target cells respond to the same neurotransmitter differently, depending on the type of receptor that the target cell has. And there are two classes of receptors for acetylcholine and two classes of receptors for norepinephrine. All preganglionic neurons in both divisions secrete acetylcholine, and also postganglionic neurons that are parasympathetic also secrete this acetylcholine. So axons secreting acetylcholine have a special name, cholinergic fibers, and any receptor that is able to bind acetylcholine, we have a special name. Those are the cholinergic receptors. We can further subdivide cholinergic receptors into muscarinic receptors and nicotinic receptors. So the muscarinic receptors are found in heart, in the smooth muscle, and gland cells. And these can be excitatory or inhibitory based on what subclass of muscarinic receptors we're specifically talking about. Nicotinic receptors, on the other hand, are found in all of the autonomic nervous system postganglionic neurons, also in the adrenal medulla, and at the neuromuscular junctions of skeletal muscles. They are always excitatory when acetylcholine. Norepinephrine is secreted in nearly all of the sympathetic postganglionic neurons. And these have a special name. We call them adrenergic fibers. Okay, so these receptors for norepinephrine are called adrenergic receptors. And likewise, we have two subclasses here. We have the alpha adrenergic receptors, and they are usually excitatory. And we can subdivide them again into alpha and alpha 2, alpha 1 and alpha 2. Then, usually inhibitory are the beta adrenergic receptors, and we can subdivide these into beta 1 and beta 2. When we're talking about effects on glandular secretions, often autonomic effects are indirect consequences from actions on the blood vessels. So we have two ways that this can go. We have vasodilation. It's going to increase blood flow and then also increase secretion of whatever is coming out of the gland that we're talking about. And vasoconstriction. And just the opposite. Vasoconstriction is decreasing blood flow and therefore decreasing secretion of whatever thing we're talking about. Now, we have a lot of different ways that we can modulate acetylcholine and norepinephrine function. Sympathetic fibers can also secrete something called enkephalin. They also secrete substance P, neuropeptide Y, somatostatin, neurotensin, gonadotropin-releasing hormone. When we talk about the parasympathetic fibers, they can stimulate endothelial cells to release nitric oxide, and that can cause vasodilation and inhibit smooth muscle tone. Now on to this concept of dual innervation. So most viscera receive nerve fibers from both parasympathetic and the sympathetic divisions, and this is the heart of dual innervation. They can have antagonistic effects or cooperative effects. Okay, so pretty obviously the antagonistic effects happen when the two divisions oppose each other, and cooperative happens when they work together to make stronger. They don't tend to have equal influence on any one set of organs. Generally speaking, the parasympathetic are more involved with digestive organs, and the sympathetic are more involved with the ventricular muscles of the heart. We talked a second ago about the antagonistic effects that the sympathetic and parasympathetic nerves can have on one another. So when we have impact exerted by dual innervation on the same effectors, we can see the heart increasing or the heart decreasing depending on which nerves are involved. Talking about the cooperative effects, the parasympathetics increase the salivary serous cell secretion, and the sympathetics increase the salivary mucus cell secretion. So we have two different glandular secretions happening simultaneously, one from one system and one from the other. We have some effectors that only receive information from sympathetic fibers. These include the adrenal medulla, inside of the adrenal gland that we were talking about earlier, the erector pili muscles, sweat glands, and then some of the blood vessels. When we're talking about the sympathetic vasomotor tone, the baseline firing, how often the nerves fire of the sympathetics. This is what's going to keep blood vessels in a state of partial constriction. And when we increase the firing, it leads to vasoconstriction, and then decreasing leads to vasodilation. And this is how we can shift blood flow from one organ to another as they have varying needs during the day. The sympathetic division puts a higher priority on skeletal muscles and the heart when a person is in some sort of emergency. Simultaneously, the blood vessels that lead to the skin constrict when a person is injured during some sort of emergency, and that minimizes bleeding and blood loss. We're wrapping up here with section 15.4. We're going to be talking about central control of the autonomic function and how the ANS is influenced by the CNS. There are several levels of the CNS that have an influence on the ANS. So first we have the cerebral cortex. This, if you remember from when we talked about the different portions of the brain and how those influence things, we have anger, fear, and anxiety that are arising from patterns in the cerebral cortex. And these powerful emotions are able to change the autonomic nervous system because we have connections between our limbic system and the hypothalamus. The hypothalamus is a center of motor control, and it has nuclei for the primitive functions, specifically hunger, thirst, and sex. So a few more levels of regulation here. The midbrain pons and medulla oblongata in the brainstem. The nuclei here are related to cardiac and vasomotor control, salivation, swallowing, bladder control, changes in the pupils of our eyes, and sweating. Spinal cord reflexes are yet another layer of control here, and these are going to have an impact on our ability to defecate kind of on command. Tertian reflexes of the spinal cord. Also, the skeletal sphincter muscles. If the spinal cord is damaged, the smooth muscles of the bowel and the bladder are controlled here. That's why we see lack of control with certain spinal cord injuries. And we're going to finish up with talking about how some drugs can have an influence on the nervous system. We call the study of drugs' impact on the nervous system neuropharmacology. And we have a couple different broad groups of drugs, and we can talk about what they do to the body. So the first one, sympathomimetrics. These enhance sympathetic activity. Okay, so this we can see in cold medicine that dilate bronchioles while constricting the basal blood vessels. We have the sympatholytics. Okay, these are able to suppress the sympathetic activity. Okay, so this could be beta blockers that bring down chronically high blood pressure by interfering with epinephrine and norepinephrine and its effects on the heart and the blood vessel. We also have many drugs, Prozac included, that are playing a role in the neurotransmitters of the central nervous system. So serotonin, for instance, is involved in neurotransmission between axons and dendrites, and Prozac blocks some of the reuptake of serotonin to allow serotonin to stay in the synapses longer, and that tends to have a mood elevating effect. And finally, I'm sure most of us are very familiar with caffeine at this point. Caffeine competes with something called adenosine. And adenosine promotes sleepiness. Okay, so caffeine binds to adenosine receptors. You can see how the structure is kind of similar to the structure. So caffeine kind of slides into the receptor where adenosine would normally fit in, and it prevents sleepiness that way.